To GLP-1 or not? Well, I'm going to give you my personal opinion as well as my professional opinion. Maybe unsolicited, but whatever. Anyway, so I have been taking a GLP-1 for almost a year. I did start it as I noticed that it was hard for me to lose weight as I went into menopause, perimenopause range. As a lot of women in my age group may know, it is difficult to lose weight and maintain a healthy weight when your estrogen levels are all over the place and your progesterone levels are all over the place. You're losing sleep, which attributes to weight gain. Your moods are all over the place, which may attribute to overeating and things like that. Of course, in my family, we eat if we're happy, we eat if we're sad, we eat if we're just vegging out on a movie or something like that. And so, again, it can be difficult to lose weight as you get into that range where I am. And so a lot of women probably can relate. I have had some success with the GLP-1. I am on a maintenance dose now. I have lost, I think in a year, I've lost about maybe 20 pounds or so, give or take. 'Cause some weeks I won't take it. If I'm on vacation or something like that, I won't take it because I do like to enjoy my food. So that is one of the problems with the GLP-1. It's like you'll sit there and you'll be all in front of a good steak or a good baked potato loaded and everything. And you're like, yes, I'm about to eat 2 bites in. And you're like, yeah, nah, I'm good. But so those are things to consider. Also, you need to work out. You do lose a lot of muscle when you're losing weight with the GLP-1. Side effects are also constipation, so you have to have a good fiber source in. And I usually use magnesium, liquid magnesium at night. Also, a problem can be just mood swings. You don't think about this, but this is a thing. I think it's because we're so attached to food, right? Food makes us happy. Food makes us joyous. It helps us, we're looking forward to family environments where we got food going. And I did find sometimes where I was so excited to go out or be attached to things, I was not because my appetite wasn't there. So then I was like, I don't really need to go out to dinner. I don't really need to fellowship with family members and all of those things, or friends and all of those things, because there was always that attachment to, we're going to go to that nice restaurant we like, right? So you have to think about that. It's not made for everybody. It's not. And some people don't see the weight loss, but there are 2 different types. There's the tirzepatide, which is Zepbound and Mounjaro. And then, research supports that you see more weight loss with the tirzepatide because it has the 3 components to help you lose weight, which is the food noise, the cravings, and then there's it takes those cravings away and that addictive trait that we kind of see with food, with food and things of that nature. And then you have the semaglutide, which was the most popular one, which was Ozempic and Wegovy. And now they have the Wegovy pill out. So there's some options for people who don't like the injectables or don't like to inject themselves, because a lot of times if you're on these, you do have to inject yourself once a week. And so, again, myself, I'm on a maintenance dose, which I think I'm at about 2.5, sometimes 5. I teeter between 2.5 to 5 milligrams a week. You must stay hydrated. I know I'm always talking about hydration, but it's so important because, again, when you lose the weight, especially if you're losing a significant amount, you get the saggy skin, and then for women who are perimenopause, that saggy skin is going to be a thing sometimes. And so I'll be talking about some skincare things that you can do about that. But GLP-1s, they are okay. They actually been out on the market a very, very long time. They've been prescribed for diabetics. It's a hormone that we make, and we kind of either don't make enough for some people, or, it's just not, it's non-existent, and it's in our gut that we make it. So I'll get down and break it down some more about that. But they are effective. If you have a family history of medullary thyroid cancer or any type of thyroid issues, I would say definitely delve in closer to that. Learn more about your family history, making sure that you check into that before starting it. Also, just checking your thyroid often. Your thyroid does sit right here at what most people would say is your windpipe or your trachea. You can feel your thyroid. It's like a little butterfly around your trachea area, but if it's enlarged or it's doing some weird things, just definitely follow up with your provider to make sure you're keeping an eye on that. But I'll talk some more about that. All right, guys. Have a good day. Bye.